Hello, welcome to the channel. In today's video, I'm going to share the 10 possible causes of hair loss in women. And you need to be very attentive to the video, and don't forget to subscribe to the channel and like. So, hair loss is a problem that affects both sexes and that develops gradually over the years. However, there are situations in which it occurs abruptly, that is, new hairs are born to replace the hairs that fall out after a certain period of time. Losing between 50 and 100 hairs a day is perfectly normal and not noticeable. However, there are situations where hair loss is excessive and where new hair cannot replace the lost hair. It is impossible to count the amount of hair lost per day. However, if you notice a large amount of hair lost when washing or combing your hair, you should see your dermatologist before the problem gets worse. Hair loss can occur more sharply during the autumn months. One of the causes that leads to this seasonal fall could be sun exposure suffered in the summer, which weakens the hair follicles. Hair loss can be considered normal if it is caused by the natural aging process of each person. As we age, the hair regeneration cycle deteriorates, resulting in hair loss and thinning over the years. Going to first cause of hair fall is hairstyle. Your hairstyle can cause hair loss when your hair is styled in ways that pull at your roots, such as tight ponytails and braids. In middle age, we often pay for what we did when we were younger. When it comes to hair, that could mean all the traumatic styling we did in our 20s and 30s. Braids, wefts and tight ponytails put pressure on the hair roots. These practices damage the hair follicles and can lead to scarring and permanent hair loss. The second cause of very common hair loss is stress. Stressful events are usually one of the main causes of hair loss in women. This type of hair loss is called telogen effluvium. But you won't go bald due to stress-induced hair loss. Depending on the length of your hair, it can take anywhere from 12 to 18 months to fully correct. The increase in the concentration of cortisol in the body denotes stress. And since hair is not essential for the functioning of the body, our organism stops taking care of it to help other areas in situations of stress. Stress is interpreted as danger. In chronic stress, this drop ends up being more persistent, more severe, and deserves care. The next cause is genetics. Genetics. One of the most common reasons for hair loss in men and women is genetics. You can inherit hair loss genes from one or both parents. In women, hereditary hair loss usually starts after the age of 40. You may find that your part is wider or that your hairline is further back than it used to be. In most women, hair loss progresses slowly over the years, but without treatment it can affect the entire scalp. Women tend to lose less hair than men. But people of all genders are susceptible to hereditary hair loss. In fourth place, we have thyroid problems. Other types of hormone-related conditions can also contribute to hair loss. An underactive thyroid or an overactive thyroid can result in hair loss, because each condition causes a hormone imbalance. Thyroid hormones help regulate almost every function in the body, including hair growth. In fifth place are nutritional deficiencies. Deficiencies in certain vitamins and minerals can lead to hair loss and decreased hair growth because they aid in the hair growth cycle and cell renewal. Examples of vitamin deficiencies that can cause hair loss include inadequate protein, biotin, zinc and iron. Poor nutrition or severely restrictive or fad diets can lead to all sorts of nutritional deficiencies, which in turn can result in hair loss, from thinning hair to patches of baldness. Additionally, it's important that you incorporate fatty fish, berries, leafy greens and other foods that can promote healthy hair growth into your diet. She also notes that even a healthy diet can have its limitations. In sixth place, we have medicines. A possible side effect of some medications is hair loss. If you think a medication is causing your hair loss, ask the prescribing doctor if hair loss is a possible side effect. Some medications can cause hair loss. The most frequent are some anxiolytics, antibiotics, and especially chemotherapy. But all these drugs are prescribed by doctors, and for sure you will know these side effects and how to treat the problem. The next cause is during pregnancy and after childbirth. In pregnancy, Hair loss is relatively common in postpartum women, not only due to the hormonal changes that continue to happen in the body, but also due to the stress of childbirth. Generally, this hair loss appears in the first 3 months after childbirth and can last up to 2 months. Although more rare, hair loss can also occur during pregnancy, appearing to be related to an increase in the hormone progesterone, which can dry out hair, leaving it weaker and more brittle. What to do? The ideal is to avoid being stressed by hair loss, as it is a natural process that will improve over time. Hormonal and metabolism changes can lead to temporary hair loss, which justifies most cases of women who have the problem. Women who have gone through the experience of pregnancy will experience hair loss. Many of them can even have the opposite effect, the thickening of the wires. Some women, however, the drop in hormone levels after pregnancy can indeed lead to excessive hair loss, which needs to be accompanied by the gynecologist and, if applicable, propose treatment to seek this rebalance. The 8th cause is hormonal changes. Female hormones improve hair quality in all aspects: volume, shine, vitality, beauty. When you have some kind of hormonal change, there may be a fall or worsening of the quality of the hair. And the worst thing is that women have a lot of fluctuations in hormones. The fall of estrogen, for example, in menopause, leads to unequivocal changes. Many women only experience hair thinning, dryness, loss of volume, and do not experience hair loss. And we have the scalp infection. Scalp infection can lead to scaly and sometimes inflamed areas on the scalp. You can see what look like small black dots on your scalp. They are actually stumps of hair. Some people develop a bald spot. Lastly is diet. Crash diets can have 2 negative effects on your hair. First, your body perceives rapid weight loss as a stressful event. It thinks you are starving. Second, it could mean you're not getting the nutrients your body needs to grow healthy hair. But, if the stress continues and you have a protein or vitamin deficiency due to excessive dieting, it can limit your hair's ability to grow back. Diet can also change the appearance of hair, making it drier, duller, and more prone to breakage. And drink mostly water. This will ensure you get all the nutrients you need for healthy hair growth and a healthy body. And that's it, guys. I'm done here. I hope the video helped you. Comment, like, and subscribe to the channel.